It is Bailey Combs Baker and my cat. I go to Campbellsville University and I'm in the MSW program. Today is February 25th, 2025, and my cultural spotlight is going to be on how the University of Kentucky has launched an initiative to address healthcare disparities. So it is called the 2025 Spark Cohort, which is a group of students who are dedicated to community health research. So they are going to have activities like a health disparities book club, academic belonging seminars to help students address healthcare disparities through community engaged research. So I thought that was interesting, just because I feel like I don't know, Lexington is a very growing city. So I think it's really cool to see us address global issues. Let's see. So as I said before, this week's assigned problem is healthcare disparities. So I chose an article from the UN News called Ukraine Keeping the Lights On During the Darkest Times. So back in 2022, Ukraine was invaded by Russia, and they are still civilians are still being affected by this. So 12.7 million people are in need of humanitarian assistance. So during the invasion, Ukraine received significant infrastructure damage. And the article kind of talks about how they have come up with innovative solutions to maintain electricity supply to ensure essential services like healthcare can operate. So they're facing extreme disparities that are exacerbated by the war with Russia. However, before the invasion, Ukraine had already struggled with some healthcare disparities, just like low vaccination rates, high prevalence of non-communicable diseases like hypertension and obesity, and there was a rise in the HIV/AIDS epidemic. So due to the war, there's an increase in shortages of things like medical supplies, healthcare professionals, and also disruptions of services that people were already receiving, especially in conflict zones. In chapters 11 and 12 of Global Problems, Cernal discusses the impact conflict has on health systems and the importance of sustainable development. So war exacerbates disparities in healthcare by damaging infrastructure, disrupting services, and diverting resources, just like what is happening in Ukraine. So the article has a huge focus on maintaining energy and supplies, which is what is essential for healthcare facilities to function. So my idea of how to address this issue is kind of establishing mobile healthcare units for conflict zones. So they would be kind of just like it sounds, but it would be for like a basic medical care, and then like a mental health services, and then one specifically for children and maternal and child health care for families. which would kind of also align with Cernav's emphasis on equitable access to healthcare in conflict zones. I think it's so easy to forget that these people are literally in conflict zones and they need healthcare immediately. So let me know what you guys think. Thank you.
For my culture